HIV, which stands for Human Immunodeficiency Virus, is a virus that attacks our immune system, and if untreated, it will cause a state of immune failure in a person. And that immune deficiency state is referred to as AIDS, which stands for Acquired Immune Deficiency Syndrome. In this video, we will talk about the prevention of AIDS, but in order to do that, firstly, we need to understand the ways of transmission of this virus. The ways you can possibly get HIV into your bloodstream and therefore develop an HIV infection. HIV can be transmitted in three ways. The first one is sexual fluid contact. The second one is blood transmission. And the third one is from an HIV-infected mom to her baby. Now let's talk about the most common way HIV spread, which is sexual fluid contact. It usually happens when an individual having unprotected sexual intercourse with someone who has HIV. That's saying having anal sexual intercourse, vaginal sexual intercourse, or oral sexual intercourse with an individual who is infected by HIV will give you a higher chance of getting infected. In general, unprotected anal sex with either a man or a woman is the highest risk sexual behavior because not only is there exposure of HIV-infected sexual fluids to mucous membranes, but if there is any open cut to the involved body part, the virus in the blood there will also increase the risk of infection.
In this case, virus from infected sexual fluid or blood can get across the mucous membranes of an uninfected person, or it can just get dirty into a person's bloodstream through an area that might be bleeding.
This is Angelina.
And this is Tom.
They just meet in a club at a Saturday night and decide to spend a wonderful night with each other. Oh wait, do you have condom?
Oh shoot, I forgot it.
Hell no!
Oh my god, honey, trust me, I'm clean, totally clean.
Well, oh, alright. Oh my god, HIV.
Here comes the second way of HIV transmission, that is the blood transmission. It is mainly consists of two parts. 1. Particular procedures including needles contaminated by someone else's blood. For example, using intravenous drug and sharing needles with an HIV-infected person. 2. Contaminated blood transfusions. It is no longer a big issue these days, at least in most countries, because of some seriously rigorous screening of donor blood and the blood supply in the blood bank. To prevent that, people who use injected drugs should only use clean and sterile needles obtained from reputable sources.
The last way of HIV transmission is from an infected mother to her baby, and it can be separated into two cases. The first one is the mother gave HIV virus to her baby during childbirth. The baby is being exposed to mother's blood and vaginal fluid on the way out of the mother's body. And moreover, the newborn baby's skin are very thin, so there is the possibility that the HIV virus to get into the baby's body through their skin.
The second one is the mother gave HIV virus to her baby through breastfeeding. Breast milk in an infected mom will contain HIV virus, so when the baby feeds, it will be ingesting lots and lots of HIV particles. Then the baby will get infected by absorbing the milk through digestive tract.
Luckily, there are ways to prevent this transmission from happening. There are all sorts of medications that we can give to the mother before and after her pregnancy, and there is also medications that the baby can take as well. All of this dramatically reduce the risk of the mother passing her HIV virus onto her baby. A condom can help to prevent the spread of HIV since it helps to prevent the exposure of an uninfected partner to HIV-infected semen and protects the male's penis and urethra from HIV-infected vaginal or rectal fluids, blood, or other body fluids. Moreover, you can also help to prevent HIV by treating your other STDs, especially those that cause open sores, because HIV can enter the body through those open sores.